From the beginning of man, demons, spirits, ghosts and jinns have been blamed for the vile thoughts and beastly acts of humans. It has challenged and pushed man's capacity of understanding these forces of evil at large. In this documentary, we will explore if it's all in the mind or if demons can really possess and influence human beings. This conflict between good and evil is found in history through every culture, mythical tradition and religions. Demons possessing man is not a new belief, yet in today's society doubts have risen whether demons are actually invading our lives, or are there other explanations to this unnatural behavior and paranormal activities? Is it really just depression, anxiety, bipolar, personality disorder, or even superstition? Is there a possibility that it can be both demonic possession and mental health? Or are these separate matters with similar traits and symptoms? People are scared, cautious to ask deeper questions about demons with the belief that disturbing such entities could end up with evil forces affecting or disturbing their lives. Does this search to understand such evil entities really enable them to cause harm and enter humans, disturbing and taking over the human body, controlling their actions, thoughts, behaviors, and health? Spiritual afflictions have become a taboo in today's media, whereas mental health issues are now being given as daily diagnosis. According to studies, statistics show 1 in 4 people will be affected by mental health issues at one point in their life. Are these behaviors really due to a person's condition in regards to their psychological and emotional well-being, or is this truly from a spiritual affliction? Demonic possessions is a worldwide known term used to believe in demons, ghosts, spirits, and jinns. These dark forces take over the human body, controlling actions, thoughts, and behavior, some believing they can cause health issues from headaches to even cancer. Demonic possession is recognized by many different religions and cultures. Examples of these religions include Islam, Judaism, Christianity, Hinduism, and Buddhism. Demonic possession is not only founded to religions, but is recorded throughout history from all cultures around the world, such as Haitian Hoodoo, Wicca, Southeast Asian, Mexican and African traditions, and the rest of the world. During 1969, a study was funded by the National Institute of Mental Health in regards to possession. Its core belief existed in 74% of respondents from a sample of 488 societies across the globe. Depending on the views from the cultural context, possession is viewed to be a voluntary or an involuntary act. Some cultures view it to be beneficial rather than it being detrimental to one's health, body, and mind. In today's time, many people are turning to science for answers. Neurologists were shown a documentary on demonic possession, and their views were somewhat surprising. Neurologist William Neal has performed over 5,000 surgeries, yet was unable to explain the actions of those who were demonically possessed. To him, it looked like a state called delirium. He was surprised, as this is not linked to a brain disorder. He wouldn't be able to operate on such an individual to get any medical answers or cure. He doesn't believe brain surgery would be successful in any way. Some neurologists believe that only religious people are affected and others are not. Does this mean that non-religious people are unable to experience demonic possession? Itzhak Freud, a professor of neurology, said that it looks authentic and real, but believes that you will not find this in someone who has no religious background. He thinks that religious people will alter their brain according to their religion. They are likely to behave according to what they absorb from their religious teachings. Although the neurologist states it's clear something is happening, he doesn't have the answers to what it could be medically. He believes there is a limitation here to human understanding. With no tangible answers, this steers the neurologist to make up a conclusion based on their opinion and assumptions. It's not surprising that those uncompromising in their scientific views will not accept anything else, unless they come to a conclusion on their own. John Mazziota, who has been practicing neurology for 35 years, thinks these are behaviors generated in the brain. How it's done and what is it, he can't say. In patients who suffer from seizures, which originate from the temporal lobe, they become more religious. Uncertain why there is a coincidental link between the two, he states that unless it was proved to be a seizure, which in this case he doesn't believe it is, no procedures in neurology will cure this. If neurology is unable to cure those with demonic possession, what other methods can be used? A neurologist who is unable to come to a conclusion will send the individual to a psychiatrist. The neurologists believe that psychotherapy will work, but no medication is needed. Ryan E. Lawrence, a clinical psychiatrist, stated the opposite. This is somewhat surprising that neurologists are actually stating that no medical intervention is needed to cure the person with these conditions, whilst psychotherapists are using medicines. If this is the case, why are so many people given medication that causes many side effects but are not actually beneficial to curing the person? It is surprising that patients who couldn't be given any scientific cure find answers within religious scriptures. If qualified neurologists are unable to give us the answers from the medical perspective, should we also look towards religion? 5 psychiatrists watched a video of an exorcism being performed. They were asked if this could be a fraud or lie. They all strongly concluded no, even stating that for some people an exorcism would be good due to their belief, which creates a placebo effect. Psychiatrists prefer not to take sides or have a belief system in place due to this falling under religious views. However, they do believe in the phenomenon itself. Their treatment of such cases is psychotherapy. Over the years, scientists have discovered things that they haven't understood till this day. Is demonic possession another field of science that has yet to be explored by scientists? Demonic possession is a condition that is recognized worldwide. Many will still not use the terms Jinn possession or spiritual afflictions when in a professional capacity, even when they fail to answer why this is affecting people from all walks of life. Why are neurologists and therapists so hesitant to look to religious scriptures for answers that science and medicine cannot conclude? Is it because of the taboos of exorcism and the deception and barbaric methods that have happened during these procedures? Can it be due to the reputation of religious and spiritual healers and the barbaric practice where people have been harmed and killed in the process? How often can we cite incidents of people killed in the hospital accidentally, Yet medication science and professionals are not questioned.